Most people with high blood pressure feel completely normal. No headaches, no chest pain, no dizziness, nothing, so they assume they are okay. I've had patients sitting right across from me. Blood pressure, textbook perfect at their morning visit, who were having a cardiovascular crisis every single night while they slept. They had no idea, and I almost missed it too, because I was only looking at the same snapshot every other doctor looks at. Here's what changed everything. What I found when I started looking at what their blood pressure was actually doing at 2 in the morning. And here's the one thing I tell every patient over 55 to do before they go to bed tonight. Stay with me, because if you have high blood pressure or you've been told your numbers are borderline, what I'm about to share could genuinely matter for your life. Here's something that doesn't get talked about nearly enough in a standard doctor's office. When you come in for your appointment, we check your blood pressure once, maybe twice. It takes about 45 seconds. And that number, that one single reading, becomes the foundation of your entire treatment plan. Think about that for a moment. 45 seconds out of the 86,400 seconds in your day. That's what we are basing your cardiovascular care on. And here's the part that should make you stop and think. For roughly a third of those 86,400 seconds, you're asleep, unconscious, with no one monitoring anything. And that's exactly where the real story is happening. Under normal, healthy conditions, your body does something remarkable while you sleep. Your blood pressure drops anywhere from 10 to 20% below your daytime levels, every single night like clockwork. We call this the nocturnal dipping pattern, and it's not a nice bonus, it's essential. Your heart uses that window to repair itself. Your blood vessels recover their flexibility. Your kidneys process waste products from the day. Every one of those processes depends on that nightly pressure drop happening the way it's supposed to. But here's where things start to go wrong for a lot of Americans, especially after 55 or 60. As we age, our arteries stiffen gradually. The blood vessels lose some of their elasticity, and the autonomic nervous system, the part of your nervous system that controls and regulates that nighttime drop, starts losing its precision. The signals get weaker, less consistent. For a significant portion of adults over 65, that drop simply stops happening. The pressure stays elevated all through the night, and this is the part that genuinely concerns me, it actually rises higher during sleep than it ever was during the day. And you'd have absolutely no idea. You wake up a little tired. Maybe your head feels heavy. You think you just didn't sleep well. But the real explanation is something completely different. Let me give you a real example, because this is the kind of case that changed how I practice. A patient comes in, 58 years old, active guy. He walks his dog, goes to the gym a couple times a week, eats reasonably well. His office blood pressure, 122/79. That's practically perfect. I would have sent him home with zero concern. Instead, I sent him home with a 24-hour blood pressure monitor strapped to his arm. At his office visit, 122/79. At 1:30 in the morning, while he was sound asleep, 168/106. That is not a mild elevation. That is a hypertensive crisis, happening silently while this man slept in his own bed, completely unaware, night after night. How does that happen to someone with a normal office reading? 3 reasons. And all 3 are far more common than most people realize. First, his medication was taken first thing in the morning. By late evening, its protective effect had worn down significantly. He had a coverage gap right when his cardiovascular system needed it most. Second, his stress hormones, specifically cortisol and adrenaline, weren't following their normal nighttime rhythm. Instead of tapering down the way they should, they were spiking during sleep. Third, his sleep was fragmented. In every brief awakening, even ones he never remembered in the morning, was triggering a sympathetic nervous system surge, a pressure spike, and then another and another. Every single night, not occasionally, every night, that kind of repeated, undetected pressure elevation doesn't just pass through your body harmlessly. It leaves damage in the walls of your arteries, in the tiny vessels in your kidneys, in the tissue behind your eyes, silent, accumulating. Month after month, no symptoms to signal that anything is wrong. Until the day the body can't compensate anymore. We have a name for people whose blood pressure doesn't drop at night the way it should. We call them non-dippers. And the numbers here are important, so I want you to really hear this. More than 50% of adults over 65 are non-dippers, more than half. This is not a rare condition. This is not an age case. This is the majority of older Americans carrying a hidden cardiovascular risk that their morning office readings will never detect. What does that mean for outcomes? Non-dippers have a cardiovascular mortality risk roughly 3 times higher than people who dip normally, even when their daytime blood pressure numbers are identical. Same readings, same medications, same diet. The only difference is what happens during those 8 hours of sleep. And then there's an even more concerning pattern called reverse dipping. These are people whose pressure actually climbs during sleep, higher at night than during the day. For reverse dippers, stroke risk increases by a factor of 4 to 5. They feel completely fine at a routine checkup. Standard office visits catch none of this. Not a single reading. Not one data point from those 8 hours. That is the diagnostic gap I want to help you close today. Before we get to the drink, and I promise we'll get there, I want to cover 3 things that may already be in your home, silently driving your nighttime pressure higher. You might be genuinely surprised by at least one of these. The first is licorice root. I know, it sounds completely harmless. It's herbal tea. People drink it in the evening to wind down. Completely natural. But licorice root contains a compound that blocks a specific enzyme in your kidneys. When that enzyme is blocked, cortisol builds up in your bloodstream. Elevated cortisol at night means your pressure climbs. You don't feel it. You just wake up exhausted with no clear reason why. Here's the part most people miss. Licorice root doesn't always say licorice root on the label. Check your evening tea right now for the words glycyrrhiza, sweet root, or just natural flavoring buried in an herbal blend. That's where it hides. The second is evening alcohol, and I want to be careful here because I'm not here to lecture anyone, but here's what the physiology actually shows. And most people don't know this. When you have a drink in the evening, the initial effect does temporarily lower blood pressure. That part is real. But 3 to 4 hours later, right in the middle of your deepest sleep, your sympathetic nervous system overcorrects. It rebounds hard. Your cortisol spikes. Your blood pressure can actually reach its highest point of the entire 24-hour cycle, somewhere around 2 or 3 in the morning. Whether you feel it or not, whether you remember waking up or not, it's happening. The third is grapefruit juice. Specifically if you're taking amlodipine or another calcium channel blocker. Grapefruit blocks the liver enzyme that breaks down these medications. The drug accumulates in your system far beyond what it was designed to do. what was supposed to be a controlled, gradual effect becomes dangerously prolonged and unpredictable. And that unpredictability is most dangerous at night, when there's no one monitoring you and no easy way to respond if something goes wrong. So how do you actually find out what your blood pressure is doing while you sleep? There is a test built specifically for this question. It's called ABPM, Ambulatory Blood Pressure Monitoring. You wear a small cuff on your arm for 24 hours. You go about your normal life. Cook dinner, watch TV, go to sleep. The cuff takes automatic readings every 30 minutes throughout the day and night. When you bring it back, it gives us a complete blood pressure profile across all 24 hours, including every hour of sleep. This is the gold standard for identifying non-dipping patterns, the only way to actually see what your nighttime cardiovascular system is doing. And most adults over 60 have never worn one. Ever. If you want this test, you need to ask for it by name. Write it down, a BPM, because if you don't specifically request it, there is almost no chance it gets ordered at a routine visit. The second test is urine microalbumin. This measures a tiny protein called albumin that leaks into your urine when your kidneys are under sustained pressure stress. It's one of the earliest detectable signs of organ damage, showing up years before your kidney function visibly declines on a standard panel. It's a warning signal while there's still time to change the outcome. The third test is oxidized LDL. You know LDL as bad cholesterol. Oxidized LDL is what happens when that cholesterol gets damaged by free radicals. Essentially, rusted cholesterol, far more destructive to arterial walls than regular LDL. Standard cholesterol panels don't measure it, but it is a direct marker of arterial wall damage, exactly the kind that sustained nighttime hypertension accelerates. Write these three down right now. A BPM, urine microalbumin, oxidized LDL. That is your complete agenda for your next doctor's appointment. Those three tests together will give you a picture of your cardiovascular health that no routine checkup has ever provided. All affordable, all widely available, almost never ordered unless you walk in and ask for them specifically by name. Now let's talk about solutions. Starting with one that costs absolutely nothing and requires no new prescriptions. The timing of when you take your existing blood pressure medication. Most people take their blood pressure pill in the morning. That's the default. That's what we were trained to tell patients for decades. But here's the problem with that for a lot of people. Most antihypertensives peak within a few hours of being taken and then gradually lose their effect throughout the day. If you take your pill at 7 a.m., it's by midnight the protective window has significantly closed, right at the same time your nighttime cardiovascular risk is at its highest. A major clinical trial looked directly at this question, the Hygia Chronotherapy Trial. Over 20,000 patients, 6 years of follow-up. One of the largest cardiovascular studies ever conducted. Researchers compared patients taking the exact same medications at their usual morning time versus at bedtime. Same drugs, same doses. The only variable was timing. The bedtime group had nearly 50% lower rates of heart attack, stroke, and cardiovascular death. 50% from changing when the pill was taken. I have to be very clear here. Do not adjust your medication schedule on your own. Some medications, diuretics especially, absolutely should not be taken at bedtime. Your doctor needs to review your specific case before any change, but the conversation is completely worth having. One question at your next appointment could change everything. Now, the drink. I want to tell you about something that's been sitting on the shelves of health food stores for years that most cardiologists never mention, but that has real, replicated clinical evidence behind it. Hibiscus tea, specifically the dried flowers of Hibiscus subdarifa. And I want you to hold off on dismissing this, because I'm not talking about folk medicine here. I'm talking about peer-reviewed trials. Hibiscus flowers contain compounds called anthocyanins, the same molecules responsible for the deep color in blueberries and pomegranates, powerful antioxidants that neutralize the free radicals that damage arterial walls. But hibiscus also does something else. It inhibits ACE, the angiotensin-converting enzyme, the exact same enzyme that a major class of blood pressure medications is designed to block. That's not a coincidence. That is a pharmacological mechanism found in a plant, studied across multiple independent research groups. Multiple clinical trials have shown consistent blood pressure reductions in patients with mild to moderate hypertension who drank hibiscus tea daily, reductions of 8 to 14 millimeters of mercury in systolic pressure in patients not on medications. That is clinically meaningful. Now, preparation matters enormously here. Most people make it far too weak to see any real benefit. Use 10 grams of dried hibiscus flowers, not a tea bag, not a blend. Actual dried flowers. Water at about 90 degrees Celsius, just below a full boil. Steep for 10 to 15 minutes. Not 5, not 7, 10 to 15. The active compounds need that full extraction time. When it's properly brewed, the color should be a deep, rich burgundy, almost like dark red wine. If it looks pale pink, it needs to steep much longer. 3 cups per day is the amount studied in clinical literature. But the most important cup, the one that specifically targets your nighttime pressure, is the one you drink 1 to 2 hours before you go to sleep. That timing window is where it has the most meaningful impact on what happens to your cardiovascular system overnight. One important caution: if you're already on blood pressure medication, talk to your doctor before adding hibiscus tea. The effects can be additive. This is not meant to discourage you from trying it. It's just a reminder that even natural compounds with real mechanisms interact with real drugs. Have that conversation first. You've taken in a lot of information, so let me bring it down to 3 specific things you can actually do tonight. Just 3. 1. Go to your tea cabinet right now and read every single label. Look for licorice root, also listed as glycyrrhiza, sweet root, or hidden inside natural flavoring. If you find it in your evening tea, that tea moves to the morning shelf, or out of the house entirely. Tonight. 2. Be honest with yourself about your evening alcohol. Not harsh, just honest. Is it happening regularly? Is it close to bedtime? If the answer is yes, understand that the rebound pressure spike is real. It's happening at 2 or 3 in the morning, whether you feel it or not. You don't necessarily have to stop, but consider shifting it earlier, with dinner not in the hour before you sleep. 3. Take out a piece of paper and write down 3 things. ABPM, microalbumin, oxidized LDL. Fold it. Put it next to your insurance card or your pill organizer. That piece of paper is your entire agenda for your next doctor's visit. 3 items, affordable, available, and they will show you a picture of your cardiovascular health that your morning office appointment was never designed to capture. Here's what I want you to understand at the deepest level. Your cardiovascular system never stops. Right now, as you watch this, your heart is beating. Your vessels are under pressure. It never rests, not for a single second. And after 60, the margin for silent, undetected damage is narrower than it was at 40 or 50. The body is extraordinary at compensating, at absorbing damage quietly, without symptoms, without complaint until the day a threshold is crossed. And for far too many people, that threshold is crossed at night, while they sleep, while they dream, with absolutely no visible warning sign. I've been at bedsides after strokes, after major cardiac events. I've had those conversations with families, and I remember every one of them. In a significant number of those cases, especially in patients over 60, the warning signs were already there. In data that was never collected, in nighttime readings nobody took, in microalbumin slowly rising for years with nobody watching. In a lot of those cases, the outcome could have been different with one more test, with one informed question at one appointment, preventable. In many cases, yes, medicine is humbling, but it is far more preventable than most people believe. When they have the right information, when they ask the right questions, when they walk into that appointment prepared, you have a right to ask about your nighttime blood pressure. You have a right to ask about ABPM, about medication timing, about these 3 tests. You are not being difficult. You are not being demanding. You are being an active, responsible participant in your own health. And that engagement, in my experience, genuinely saves lives, not as a saying, as a clinical reality. The patients who bring lists, who ask follow-up questions, who come in prepared, they get better care consistently. That's not my opinion. That's what the data shows. Let me bring it all together before you go. Your daytime blood pressure reading is a starting point, not the complete picture. Nighttime pressure matters just as much, and often more. More than half of adults over 65 are non-dippers, carrying 3 times the cardiovascular risk of people with the exact same daytime readings, almost never detected by a routine office visit. Things in your home may be making it worse right now. Licorice root in your evening tea, evening alcohol, and grapefruit juice combined with certain medications. 3 tests will show you the full picture. ABPM, urine microalbumin, oxidized LDL, available, affordable, and almost never ordered without a direct and specific request. Bedtime medication dosing, supported by 20,000 patients in the Hygia trial, can cut cardiovascular risk by nearly half for the right patients. And hibiscus tea, brewed properly and taken 1 hour before bed, has genuine clinical evidence as a daily supporting measure. 3 steps to start tonight. Check your tea cabinet, write down those 3 test names, and ask your doctor about evening medication dosing. Has your doctor ever talked to you about nighttime blood pressure? Have you ever worn a 24-hour monitor? Tell me in the comments below. I genuinely read them, and your experience helps other people in this community know exactly what questions to bring to their next appointment. If this gave you something useful, share it with someone you love who's over 60, a parent, a spouse, a close friend. This is the kind of information that gets lost between appointments. Your share can be the thing that reaches someone who needs it. Subscribe if you want to go deeper on cardiovascular health. There is a lot of important ground still to cover, and we are just getting started. Everything shared in this video is for educational purposes only. It reflects current research and my clinical experience, but is general information, not personal medical advice. Please talk to your own physician before changing any medication schedule, starting a supplement, or making significant dietary changes. Your situation is specific to your history and your biology. Your doctor needs to be part of that conversation.